So there are two main barriers that we know of for Arab American health research. And when I say Arab American, I'm often referring to both Arab and MENA Americans. I will use the terms interchangeably, although I know they are not interchangeable. It's more of a habit than anything else. Thinking about the ways in which health research is sort of hindered here in a United States context, there have been two main barriers that I've identified. There are definitely more. One is general federal reporting standards for collecting data on race and ethnicity. We know, and this is sort of common knowledge by now, that Arab and Middle Eastern folks are asked to select white on any sort of census forms or any sort of racial identity forms. We know that that's also hopefully changing in the near future with the OMB's revised standards on race and ethnicity, where Middle Eastern and North African will hopefully be its own reporting category. But given the current standards and the ways in which data has been collected up until this point, this is a huge barrier to being able to collect high quality representative data on Arab American health here in the United States. People have found ways to do it. Many people on this call have found ways to do it. And there are certain data sets that you can use to understand health, but none of the data sets are really perfect. And while no solution will be perfect, we know that having a checkbox, having an identifier will help us move closer to that goal. The second large barrier is a general sense of distrust in the formal research process and data collection efforts among Arab Americans. So myself and many others who have participated in data collection on Arab and MENA health have found that it is often difficult to enroll patients and community members in studies. There's a lot of barriers to having people participate accurately, fully, especially when you're thinking about online settings. And there are many people who have thought about this process. Many people who are on this call have thought about how to better engage these populations. With those two barriers in mind, we set out to develop AAHNA, and we proposed AAHNA, which is the Advancing Arab American Health Network Alliance, for a PCORI Engagement Award, which was awarded in the spring of 2022. And we had three main goals with this proposal. The first goal was to build infrastructure for a community of stakeholders that consisted of patients, clinicians, researchers, and community organizations that would meet on a regular basis to discuss issues related to Arab American health, and that were dedicated to really improving patient-centered outcomes among Arab Americans. The second major goal was to develop national research priority areas for Arab American health and MENA health, and this involved both a literature review, but also focus groups with members of our steering group, and I'll talk to you about who is in our steering group on the next slide. And then finally, the last goal of this project was to develop a research engagement guide, and I'll be talking to you in detail about what that guide is, what the goals for the guide are, and how we envision that being used moving forward. We are coming to the end of our grant funding period for PCORI, but we're really grateful for the opportunity to be able to do this work with financial support. And one of the strong points and one of the things that we're very grateful for PCORI funding is sort of the real emphasis on ensuring that all members of the community are compensated for their time and their efforts. And you'll see how sort of we've tried to make sure that that happens for the members in our community that have participated in AAHNA. So the first goal was to develop a steering group. And in order to do this, we really aim to have a diverse representation in our steering group. We wanted to make sure that we were able to represent not only geographic diversity, so trying to represent Arab and MENA populations from across the United States, but also sort of ethnic and country of origin diversity within the MENA population. We know that the MENA population is not a monolith. We know that it's quite diverse. And so making sure that we were able to represent the voices of many sort of subgroups within our populations. And some of our partnering organizations are shown here on this slide. We were able to partner with 4 community health organizations that represent a large a large geographic diversity. So the first organization is Access. They're in Dearborn, Michigan. They're one of the largest Arab health organizations in the country. And as we all know, Dearborn and the larger Detroit area is home to one of the largest Arab communities in the United States. We also worked with the Arab American Family Support Center in Brooklyn, New York. And they are a little bit more of an urban center that's aimed at families with all sorts of backgrounds, but they do have a large proportion of their clientele that is Arab or MENA. We also partnered with Somali Family Services of San Diego, and this allowed us to sort of think about the ways in which our colleagues in California were doing this type of work. We know that there's a very large Arab and MENA community in California. And then also think about the ways in which Somali populations may be unique or may reflect similarities to other populations. And then also Arab American Family Services in Illinois was the last addition to our steering group. And they really allowed us to get representation from the Midwest, but also think about the ways in which AAFS, and we're lucky to have the co-founder on the call today, has really contributed to care for their populations. There are some other organizations that we've partnered with, including the Center for Arab Narratives, which is the National Institution of Access, and Amina Sai, which are both sort of national groups that aim to bring together researchers who are interested in health and psychology of these populations together. And we have representations from all of these groups in our steering group. Our goal for the individual community health organizations was to have both a community health leader, a patient, and a provider from each of these organizations on our steering group. And so we've been very lucky to have a large number of folks step in and out of our steering group over time. So this is a list of all steering group members, past and present. And I want to just recognize their energy and their efforts here on the call today. Many of them are on the call today. Some of them you will hear from in our panel later on. But you can see that it's a wide diversity of folks from a number of different areas, regions, and also we have patient representatives, community representatives, and researchers on our steering group as well. One of the main goals of our grant was to really bring to the forefront voices of patients and community members who are doing this work, but also being affected by some of the policies and our goal and research recruitment strategies. And so really getting to center their voices was really an important part of this process. Our steering group met on a monthly basis, so it was a bit of a large time commitment, especially for our community and our patient members. And they helped us with dedicated outreach and feedback on many of our sort of sub-goals, our intermediate goals throughout the process. One of the things that sort of came out of our steering group meetings was really a strong, and I hope others would agree with me, a strong sense of community and collaboration that developed, especially across geography. You know, in our digital era now with Zoom and our ability to meet virtually, it really allowed us to form connections across geographies. And also, most importantly, I think, developed a way for us to connect organizations in their efforts to do very similar work across geographies. So one thing that I think a lot of our community steering group members really appreciated was the opportunity to connect with other community organizations who were doing similar work and sort of learn from each other and talk to each other about what was going on in the moment in their particular organizations. And more recently, I think our steering group has really been able to respond both in a professional and a personal way to the events in Gaza, both by providing community for folks, but also by providing a way to disseminate resources, to collaborate on resources, to make people aware of events and other things that were happening. We've really managed to produce a really collaborative group of folks who's interested in continuing to work together to improve and advance Arab health. We were actually able to meet in person in September of 2022. We had an in-person retreat that was hosted by AAFSC in Brooklyn. And the real purpose of this retreat in person was not only to do some community building, but also to discuss the research priorities we aim to develop and to develop ideas for our research engagement guide. And one of the ways that we did this during this retreat was to really have dedicated discussions on the needs of each individual organization that was represented, and also a discussion of what were these community organizations seeing as forefront issues, important issues that community members were bringing to their organizations. We did this in small groups, we did this in a larger group, and we also continued the conversation after the retreat. But it was really an opportunity to get together and to discuss the needs of these organizations and to prioritize those needs in larger conversations. Through those conversations and a number of steering group meetings, we were able to sort of develop a list of research priorities for Arab and MENA health here in the United States. And they are somewhat ranked, although not hard ranked. We had a very difficult time ranking research priorities because there are so many needs in our population. So things like mental health were really at the forefront of a lot of the services that were being provided by many of these organizations. Folks were seeing a lot of isolation and burnout. There was also a lack of adequate mental health care providers in many of these areas, especially Arabic-speaking healthcare providers or providers that understood cultural nuances. We also saw a lot of discussion among our community members about substance use and the difficulties our community is facing with regards to substance use, and also the cultural stigma that's carried with that use and how that impacts our ability to address that in a positive light. The continued needs of our community members for information with asthma and environmental hazards, especially air pollution and water safety. This is especially relevant to many of our communities that are in Michigan and Minnesota, but this is also relevant beyond that as well. Diabetes and cancer, other chronic diseases also continue to be highly burdened issues in our communities. And in direct response to COVID-19, there's a large amount of vaccine hesitancy in our communities that needed to be addressed by these community organizations. Education around vaccination and the benefits of vaccination was something that a lot of our community organizations were dealing with. A growing need in sexual health and reproductive health education, and specifically, we had a large conversation about the need for reproductive health conversations, especially around fertility and other topics that carry a lot of cultural stigma in our communities, but are extremely important for folks as they move forward in figuring out what's best for them and for their health. A lot of our community organizations are also handling questions and dealing with things related to parental education and childhood development. Things as seemingly straightforward as car seat safety, all the way up to childhood development issues like Down syndrome and autism. So there's a wide variety of needs in our community. And I think this sort of represents the diversity in acculturation, diversity in immigration status, and other things that we see in our community members. And then finally, all of our community partners really emphasized a growing need for suicide prevention and suicide awareness in our communities. Again, this carries a lot of cultural stigma, but this is definitely something that our community partners are seeing more of happening in our communities, and therefore a larger need for research in these areas. This is not an exhaustive list by any means, and I'm sure if we opened this up for conversation here, we would come up with 10 more items to be added to this list. But these were the things that our community partners brought to the table as topics of concern, topics of need that are currently in place for their organizations. We welcome feedback on this. We welcome input on this, especially from folks who might represent other communities or other groups. And we'd love to sort of continue working on expanding the list and updating the list as needs change. And after we developed these research priorities, we really wanted to make it a point to think about the ways in which we can engage our populations in research around these topics. And one way to do this, and this might seem kind of circular, was actually to ask our community about why they do or do not participate in health research through a survey, right? So what better way to ask people, do you participate in a survey, than asking them to fill out a survey? But we did have about 152 responses to a survey that we distributed through our community partners. And the main goal of this survey was to understand health research engagement and interest among Arab and MENA Americans. We implemented this survey in April and May of 2023. And it was a very diverse group of people who responded to this survey. While the majority of participants were female, about 53%, most people were between the ages of 30 and 49. We had a wide variety of education backgrounds and income backgrounds, with the majority of folks who actually answered this questionnaire with a high school or less education. We also asked people about whether or not they felt like we knew enough about Arab American health needs, and about 75% of people believed we did not have enough information about Arab American health needs. About 56% of people knew what health research was and could define it. And about 73% of folks would accept an invitation to participate in a health research study if they were asked. But this varied very greatly across income and place of birth, where foreign-born Arab and MENA participants were less likely to accept an invitation, and those with low income were also less likely to accept an invitation to participate. Some of the reasons why people noted that they might refuse to participate in health research studies was that they just simply did not have enough time to fill out a survey, or they had no interest in participating. The topic was not of interest to them. But almost universally, all respondents valued the opportunity to receive an incentive for their participation or other type of compensation for their time. And this was a theme that we also see later on in our discussions. This work we are working on submitting for publication as a sort of primer for why the work that we're doing with AAHNA is really important. While our community sees a value and a need for health research, most folks do, there are still barriers to participation, and that's something that we really want to highlight. In addition to a quantitative survey, we also undertook a qualitative survey, a qualitative interview approach, where we were able to interview about 17 folks from across the MENA population in both Arabic and English. We conducted these interviews also over the summer of 2023, and they were analyzed and themed by two individuals. I'd like to recognize their efforts, Abir Abdul, who's on the call, I believe, and Siwar Abu Hala, who are both project managers for AAHNA at one point in time. But we were able to sort of develop three themes around these interviews. One, the first theme is advancing community knowledge and health outcomes. This was really a theme about community-based healthcare experiences that participants described, and the need to advance community health outcomes as a major motivator for research participation. So some of our participants, these names are not the real names here for the purposes of these quotes. But this individual says, we all need to help one another. Otherwise, no one could benefit from me, and I could never benefit from others. I'm not living alone in this society. And just as I love Jordan, I love America. I love how here, as Arab Americans, we have a responsibility in society to care for others, to have a more practical and direct role, to further the cause for women's rights, and to get all of our rights. So this is an idea that participation in research really has a larger meaning for this individual around ability to fight for what this person believes in, and also sees it almost as a patriotic responsibility as well. Just knowing that this will help the community, it will motivate me to participate to get a better future for the upcoming generation, even our generation. So thinking about future generations' roles and responsibilities in health research as well. Our second theme that we noticed was this idea of individual level comfort and access to research. So this is really thinking about what makes participation in research feasible and more comfortable for Arab Americans. You know, for some folks, compensation is a good thing because you feel that you have contributed your time and that the interviewer is grateful for your contributions. Everyone has their own way of thanking participants for their time. So thinking about the ways in which we compensate patients and participants. And also, you know, I think a theme that came out, although maybe not explicitly on this slide here, is this idea that generosity is a very big part of our culture. And so incentives are also an important way to reflect that culture back to participants. And then the third really thinks about the ways that research then goes on to influence healthcare and health outcomes. And thinking about the structural barriers to health disparities, we saw a lot of our participants really thinking about the ways in which insurance and other structural issues were, including cost, were really prohibitive to participation in healthcare, and that went on to influence their vision and their view of health research as well. And then thinking also about language as a barrier to receiving proper healthcare, and also in participation to research. So we saw a lot of sort of similarities between the ways that folks viewed healthcare participation and research participation as well. We took all of the information that we gained from our conversations with our community partners and our steering group, the survey, the qualitative interviews, and we really aimed to transform that information in a way that was useful to the larger research community. And that was through the development of an AAHNA research engagement guide. And the goal of this guide was to provide researchers, patients, and community members basic information that would help influence engagement in patient-centered health research in Arab and MENA American communities. The goal here is not for this document to sort of live on our website or in a drive somewhere, but actually to be used by patients and providers, and something that community organizations could distribute to their patients or to their constituents, and that researchers could be able to contribute to and mold and participate in. So this was really a document that was meant to be collaborative, and there's still opportunities to collaborate on it if you're interested in doing that. So just to give you a snapshot of what this looks like, we have 4 main sections for this research engagement guide. Our first section is a patient section where we really dive into basic questions about participation in research. What am I being asked to do? What is informed consent? What's an incentive and how can I expect one? This is really written in a very I don't want to use the word basic, but basic language that should be approachable to anyone in our community. And we're hoping to have the guide translated to other languages, including Arabic, to allow for the use in a wide variety and diverse communities. This is not an exhaustive list of questions for patients, but it is at least a start that you could begin to distribute to your communities as they're being asked to participate in more and more research. And one reason this is really important as we're thinking about this new MENA identifier on the census and in other places is that we do expect there to be sort of this large amount of new health research that's going to be undertaken in our communities because of the attention that's going to be placed on them and the ability to isolate them from these data sources and these forums. And so having this guide may be helpful to some of our community members. We also have a section for researchers and providers that gives a little bit of detail about our particular community, the needs of our communities, what's been written on us before, and what are some cultural expectations that might be in place for some of our community members. So this is especially important for folks who might be coming to Arab and MENA health research and are not themselves Arab and MENA, or folks who are participating in this research and might need a little bit of extra help in figuring out what the best way to move forward is. We've also collaborated with a number of lead researchers and scholars in this area to think about what are some of the main areas of research and interest, kind of reflected off of our research priorities that we've discussed before. And these individuals have provided some context, some major readings, some things to think about for patients and providers in each of these fields. We hope to expand this section with contributions from others, including others who might be on this call today. So if you haven't had an opportunity to contribute, or if you're interested in making a contribution to this, we welcome that at any point. This guide is really meant to be dynamic. It's not meant to be a static document. And that's really why we're hoping for more collaboration with folks as we move forward. We also have an index of key terms that might be helpful for patients as they're thinking about engaging in research. This is not something that, again, is static. It's meant to be a dynamic document, but really basic definitions of things that folks may not know the definitions for, and a very convenient location that they can refer to again and again. So I want to just recognize the folks that have contributed to the substantive areas of the research guide and thank them for their efforts to contribute here. These are folks that are either researchers, academics, providers in a variety of different areas. So where can you find the guide? Siwar did paste our website into the chat, as well as a form where you can request the PDF version of the guide. I'm not gatekeeping the guide here. I'm really just providing a way for us to collect information about who uses the guide and how it's being used. So as soon as you fill out the form, we'd be happy to forward the PDF to you, and it's yours to use as you'd like. As I mentioned, it is a dynamic document, and so as changes are being made, we also want to be able to provide folks with an updated version of the guide as they use it. So if we do release a new major version of the guide, you will receive that in your email based on your filling out of that form. This was really a large community effort, and again, I just want to recognize those who have contributed to this and have made it possible. And I hope that it's useful to larger communities as we move forward and we think about how we can expand research engagement in Arab and MENA communities in the United States.